Hi there, it's Todd Smith, your member of Provincial Parliament for Bay of Quinte and the Minister of Children, Community and Social Services for the province of Ontario here at Queen's Park for another COVID-19 update for Bay of Quinte. We started to see the local cases coming down a little bit, which is great news. As of today, under 100 active cases for the first time in a little over 2 weeks in the Quinte region. So that's good news and something to feel positive about. The numbers provincially are still a little bit too high. And we took some stark measures last week to try and curb mobility for people to get those numbers down. We were presented late last week with modeling from the science table that showed on the trajectory that we were on with weak public health measures, we could be potentially hitting 30,000 cases a day. Think about that, 30,000 cases a day. We're in the mid 4,000s right now. And with medium public health measures, we could be down around 12 or 15,000. And with strong public health measures, we could get things to 5 or 7,000 cases a day, which would be all-time highs. We still haven't cracked that 5,000 case in a day plateau, but we've come close in the last week or so. So we brought in some really strong public health measures last week on the advice of the science table and our Chief Medical Officer of Health to try and reduce mobility even further so that we wouldn't continue to see that massive strain that currently exists in intensive care units in our local hospitals. Well over 700 individuals with COVID-19 in our ICUs, along with everybody else who's in the ICUs. The health table and the science table also showed us that a lot more younger people are ending up in ICUs, which is alarming. We've seen young people as young as infants ending up in hospital needing care. And we've had a lot of people in their 20s and 30s that have also ended up in more serious shape in our ICUs needing extended health care. And they are able to fight the disease longer than some of our more fragile individuals that we saw earlier in the pandemic. The other thing that's really important to note is that the variants have really taken hold in Ontario. They are the dominant strain now. Classic COVID is pretty much gone, and we're talking about the UK variant and other variants that are now in Ontario. So again, we brought in some stricter health measures, limiting outside and inside gatherings to your household only. You shouldn't be mixing with other people. You should really be reducing your mobility in general. So we don't want people out there golfing right now for the next couple of weeks anyway, until we get these numbers under control. We've extended the stay-at-home order until May the 19th, and we do have to get these cases under control. It's going to be some short-term pain for people, but really we believe it's going to be long-term gain, and our health officials believe that as well. So let's put our heads down once again, get through this, and we can get back out there and start to meet each other again, get our restaurants and our businesses open again, and get more shots into arms. So there's a real push to get vaccinations going, and particularly in the hotspot areas in and around the GTHA that have been hard hit, but also we've seen increased vaccines in our own area here in the Bay of Quinte. There are more pharmacies online now. If you haven't booked your vaccine yet, everybody 40 plus is now eligible to go and book your vaccine at a local pharmacy. So all of the information on vaccines is there at ontario.ca. And you can get the information too on the Hastings Prince Edward Public Health site. So while the mass immunization sites are continuing at places like Loyalist College, there's a lot more people that are just going to the pharmacy and booking there. And I know I've done that because I am just slightly over 40. Anyway, we now have 4 million shots in arms in Ontario. By the end of April, early May, we will have 40% of the population receiving at least one shot. And a lot of our older people, especially those in long-term care, have received both shots. So that's in spite of a lot of ongoing delays with vaccines getting shipped into Canada. We've heard another case last week of the Moderna shipment being cut in half. There are delays with AstraZeneca. We really need a more steady supply of vaccines. And when we get that, then life really will start to return to what looks more like normal. So 1,000 additional pharmacies are going to be coming online across the province in May as we start to receive more shipments, and we really do hope that they are on the way. So again, with the stronger health measures in place for a couple of more weeks, with the new enforcement that's there as well, just to make sure that people aren't gathering and flagrantly thumbing their nose at the rules. There will be a price to pay for that, and then vaccines starting to come into the country and starting to come into the province. We'll start to work our way out of this. Just a few other notes. There was a lot of great news in yesterday's federal budget, or this week's federal budget, and congratulations to the first female federal finance minister to ever deliver a budget, Chrystia Freeland, and obviously a great step forward. There was a lot of great news, as I mentioned, in the budget. The federal government pouring all kinds of money out the door, record amounts of funding and dollars, which of course we'll have to pay for down the road. But just a couple of areas that we were looking for here at the province of Ontario that we didn't see. We didn't see the government tackle the health transfer issue, which is something that not just our premier here in Ontario, but premiers right across the province, right across the country, I should say, have been pushing the federal government for the last year. That federal health transfer was 50-50 at one point. It's now 22-78, with the provinces picking up the vast majority of healthcare costs. And particularly, given the fact that we're in a pandemic and the fact that the population is getting older, the premier's really made a strong case that it was time to revisit that health transfer payment agreement and make it work more fairly for the provinces. So we were disappointed that we didn't see that. There was also some disappointment that we didn't get any new news on vaccines coming in. And I know it's just, we've never seen the contracts and the way they were signed by the federal government, but we were really hoping that we were going to see some more vaccines, and we were really hoping that we were going to see some changes when it comes to border controls, particularly at airports, where we're still seeing 36,000 people enter just Pearson Airport a week alone. So that's not to mention the international airports in Vancouver and in Alberta and in Quebec. So we thought we might see some extra measures on that to help us fight the COVID battle. And we had really pushed as of late for an enhanced sick leave benefit. I know you've been hearing a lot about paid sick leave. Good for the federal government for coming forward with a program of $1.1 billion for all of the provinces to be able to offer sick leave. And that's, a program that has changed numerous times, and you keep hearing paid sick leave, paid sick leave, paid sick leave. The federal government had taken responsibility for that with all of the provinces. We were hoping we might see an enhancement in that program because of the calls for enhanced paid sick leave. Unfortunately, that wasn't there in the federal budget yesterday. So our government is back at the table, and we'll be coming out with an enhancement or a top-up to the federal sick leave program. So stay tuned. There'll be more coming on that in the next couple of days. But in the meantime, hopefully the numbers locally continue to keep coming down. Hopefully the vaccines start to get into arms. If you haven't made your appointment yet, or if you have any questions about it, give my office a call. It's 613-962-1144, 962-1144. And we'll get you the information that you need if you can't book it yourself, but you can book it through the health unit site. You can book it through the individual sites for all of the pharmacies in the local area, or the ontario.ca site. It's all there for you. If you run into some problems though, give us a call and we'll be happy to help you out at 962-1144. Until then, stay safe, Bay of Quinte.